Look at your nails right now, before you do anything else, before you skip ahead, before you decide this does not apply to you. Look at them. Hold your hand flat, palm facing down, under whatever light you have near you right now. A lamp, a window, your phone flashlight. I want you to actually do this. Not later. Now. I am going to walk you through 4 things, 4 observations. Each one takes 30 seconds. And by the time we are done, you are going to understand something about your own body that your doctor has probably never taken the time to explain to you. First, I want you to look at the color of your nail bed. Not the nail itself, the skin underneath the nail, visible through the nail plate. That pinkish color you see, or do not see, is the color of your blood supply reaching your fingertips. In a healthy adult with normal circulation and normal organ function, that color is a consistent, even pink. Now, look at yours. Is it pink and even, or does it look pale, washed out? Is one half of the nail a different color from the other half, white near your hand and reddish-brown near the tip? Is there a yellow tint, a blue tint at the fingertip? Look carefully. Whatever you see, hold on to it, because I am going to tell you exactly what it means. Second, I want you to press the nails of your 2 index fingers together, base to base, like you are touching the backs of your fingers to each other at the base of the nail. Now hold them up and look at the gap between them. There should be a small diamond-shaped gap of light visible right where the nails meet. That gap has a name. Physicians call it Schamroth's window. If that gap is there, your nail shape is normal. If there is no gap, if the nails press completely flat against each other with no light coming through, that is a clinical finding. It is called absent Schamroth's window, and it has a specific meaning that I will explain in detail in a moment. Look now. Is the gap there, or is it not? Third, take your phone flashlight and shine it directly across the surface of your nail at an angle. You are looking for 2 things. First, any horizontal white bands running side to side across the width of the nail. Not lengthwise, sideways, like faint white stripes going across. Second, any thin dark lines, dark red, brown, almost black, running lengthwise under the nail, from base to tip, like a tiny dark splinter trapped beneath the nail plate. Do you see either of those? One or both? Neither? Keep that answer in your head. Fourth, and this is the most important one, press your index fingernail firmly with your thumb. Press hard for 5 full seconds. Count it out. 1, 2, 3, 4, 5. Now release. Watch the nail. The color will go white when you press, and then it will come back. How fast does it come back? If the pink color returns in under 2 seconds, that is normal. That is healthy peripheral circulation. If it takes 3 seconds, 4 seconds, longer, that is called prolonged capillary refill time, and it is a clinical marker I use every single day in practice to assess how well the heart is moving blood to the extremities. Time it. Remember it. Whatever you just found in that check, hold on to it, because what I am about to tell you will explain every single result in the kind of clinical detail that no doctor has ever sat across from you and delivered. If everything came back clean, stay with me. What you learn in the next 20 minutes will help you keep it that way. And if something flagged, if you saw a color that did not look right, if that Schamroth gap was missing, if there were lines or marks or a refill that was slow, then what I am about to say may be the most important thing you hear this year. I need you to subscribe to this channel before we go any further. It takes 5 seconds. We are working toward 500,000 subscribers, and every single person who joins us makes it more likely that someone who genuinely needs this information will actually find it. There is no billing code for what I am about to tell you. No clinic is going to walk you through this. There is no profit in the truth. What comes next is the part nobody in a waiting room is ever going to explain. Now, I want you to sit with something for a moment. Picture yourself at 10 o'clock at night, standing under the bathroom light, washing your hands. You catch something in the corner of your eye, a nail that looks a little different, a strange line running underneath it, a color shift you have not noticed before. And you do what almost everyone does. You tell yourself it is nothing. Stress, dry air, getting older. You reach for the hand cream and you go to bed. That moment, that quiet dismissal, is the moment I have watched cost people years of their lives. Not because they were reckless, not because they were unintelligent, because nobody ever told them that the body does not whisper quietly before it fails. It shouts. It has been shouting for months, and it writes those messages in the one place you look at every single day, without ever reading them: your nails. I have seen this in the eyes of hundreds of patients, sitting across from me after a diagnosis that could have been caught earlier. Almost every single one of them says the same thing. They say, "I knew something was off. I just did not know what I was looking at." Let me be direct with you. The idea that nail changes are cosmetic is a lie. It is a dangerous illusion, and it needs to be shattered right now. Most people, when they notice something strange about their nails, believe one of three things. They think they are not drinking enough water, they think they need more calcium or biotin, or they think it is simply aging, and aging is something you accept. And so they buy supplements. They change their hand cream, they go for a manicure, and the change on the nail remains. Because they were treating the alarm panel on the wall. The fire was in the basement. Think of your nail as a sensor attached to a pipeline. If the pipeline running through your liver, your kidneys, your heart, your lungs, your blood is functioning cleanly, the nail tells you so. Pink, smooth, properly curved, fast capillary refill. But when something goes wrong deep inside that pipeline, when the chemistry shifts, when organ function deteriorates, when blood oxygen drops, the nail matrix, which is the living tissue producing your nail, records that disruption in real time. The problem is not your nail. The problem is what your nail is reacting to. Before we go any further, I need to say something as a physician with over 20 years of clinical experience. There are symptoms that should send you straight to a doctor, not to a video. If you have a nail lifting away from the nail bed with a foul smell and redness spreading into the surrounding skin, that is an aggressive infection requiring immediate medical treatment. If you noticed a single dark brown or black streak beneath one nail that was not there before and it is widening at one end, stop everything and call a dermatologist this week. Not next month, this week. A widening vertical dark streak under a nail is one of the most misdiagnosed findings in adults over 50. It can be subungual melanoma, and it is caught early or it is not caught at all. And if all 10 of your fingernails turn simultaneously and completely white without trauma or explanation, you need a hepatic evaluation today. If none of those apply to you, you can breathe. You are going to be fine. But the quality of that life is worth protecting, and that is exactly what the next 20 minutes are for. Here is what is happening in your body right now, and I want to be precise about this. Your nails grow approximately 3 millimeters per month under normal physiological conditions. That rate is governed by 3 variables: the circulation supplying the nail matrix, your systemic nutritional status, and the activity of the endocrine system, meaning your hormones. The nail matrix itself is a crescent-shaped band of rapidly dividing epithelial cells tucked beneath the skin at the very base of your finger. These cells divide faster than almost any other tissue in the human body. That speed makes them exquisitely sensitive to any disruption in blood supply, oxygen delivery, or internal chemistry. Because nails grow outward from that matrix continuously, any systemic event that disturbs the matrix leaves a physical record on the visible nail plate as it grows outward. Like rings in a tree trunk, your nails record time. Dermatologists and internists trained in physical diagnosis can read those rings like a calendar. Most people over 50 are walking around with a detailed clinical timeline printed on their fingertips and have never been shown how to read a single entry. The first sign is what clinicians call Koilonychia, which is a condition where the normal outward dome of the nail reverses into a concave depression, scooped inward like a shallow spoon, dramatic enough in some cases that a single drop of water would sit in the center without rolling off. Go back to what you felt in the check. Run your thumb across your nails. Do any of them feel scooped? Not flat, scooped inward. That shape is not cosmetic. That shape is structural failure of the nail plate, and it occurs for a specific physiological reason. When blood iron falls below a critical threshold sustained over time, your body begins triaging oxygen delivery to prioritize essential organs. Non-essential tissues, including the nail matrix, receive less oxygenated blood. A matrix operating under chronic hypoxia, meaning sustained oxygen deprivation, produces keratin that is soft, poorly organized, and structurally compromised. The nail plate that grows from that matrix cannot maintain its normal outward curvature. It reverses. This is not a sign of one low-iron meal. This is not a bad week of eating. Koilonychia is a marker of chronic, sustained iron deficiency. And in adults over 55, research tracking over 40,000 patients at the University of Bristol found that iron deficiency presenting with physical signs, like koilonychia, had a substantially higher association with occult gastrointestinal lesions, meaning internal bleeding that produces no pain and no visible blood, than in younger populations. Not poor diet, internal bleeding that had not yet been found. And here's what comes next, and I need you to pay close attention. The second sign is Mees lines. These are horizontal white bands running across the full width of the nail, side to side, parallel to the nail base. Not vertical, not diagonal, perfectly horizontal. Each band represents one discrete systemic event. When the nail matrix is subjected to acute physiological stress, it temporarily produces disorganized keratin. That disorganization mineralizes into a visible white band. And as the nail continues to grow, that band travels toward the tip, functioning as a literal timestamp of when the stressor occurred. You can calculate the approximate date by measuring the distance of the band from the nail base, since nails grow roughly 1 millimeter every 10 days. In the 19th century, Mees lines were documented as the poisoner's mark because forensic physicians could look at a corpse's nails and calculate exactly when an arsenic dose had been administered. In the 21st century, in my practice, I see Mees lines most frequently in patients with acute kidney failure, severe systemic infections, and the aftermath of chemotherapy toxicity. Your kidneys filter approximately 180 liters of blood every single day. When kidney filtration, measured as glomerular filtration rate, or GFR, drops significantly, waste compounds called uremic toxins accumulate in the blood. Those toxins are directly harmful to rapidly dividing cells, including the nail matrix. Mees lines can appear before any blood test reveals anything alarming. They are a physical record that something has already happened inside your body. Write that down. The third sign is digital clubbing, and it is one of the most clinically significant physical findings in all of internal medicine. You just tested for it. In clubbing, the fingertip becomes bulbous and spongy, and the nail curves dramatically downward over the swollen tip. The angle between the nail plate and the skin at its base exceeds 180 degrees, and as you discovered in the second step of your check, the Schamroth window disappears entirely. If that diamond gap was absent for you, that is a positive clinical sign. Clubbing develops in response to chronic tissue hypoxia, meaning your body's cells have been receiving insufficient oxygen for an extended period. The oxygen deprivation triggers the release of local growth factors in the fingertip, which cause the soft tissue beneath the nail to proliferate and swell, and simultaneously cause the nail matrix to reorient its growth angle downward. Clubbing is associated with pulmonary fibrosis, which is scarring and stiffening of the lung tissue that reduces oxygen exchange. It is associated with congenital heart defects, chronic obstructive pulmonary disease, and lung malignancy. A review published in the British Medical Journal, analyzing over 2 decades of clinical referral data, found that previously undiagnosed lung cancer was present in a clinically significant proportion of adults referred specifically for new-onset digital clubbing without any prior respiratory diagnosis. Those patients had no cough, no chest pain, no shortness of breath that alarmed them. They had clubbing, and their nails told the story before anything else did. Now, here's the most important thing I want you to hear right now. The fourth sign is Terry's nails, named after the physician Richard Terry, who first documented it in the 1950s among patients with hepatic cirrhosis, which is end-stage liver scarring. In Terry's nails, the nail appears as though someone has bleached the color from the proximal 2/3, meaning the portion of the nail closest to your hand, leaving it white or ground glass in appearance, while a narrow reddish-brown band remains only at the distal third, the portion nearest the fingertip. 2 simultaneous processes cause this. The connective tissue within the nail bed undergoes structural changes that alter its translucency, and the vascularization of the nail bed, meaning the pattern and density of blood vessels supplying it, is disrupted by chronically reduced cardiac output or by the circulatory consequences of liver failure. The whiteness is not cosmetic. It is not age. Research from Columbia University's Department of Internal Medicine documented Terry's nails in more than 80% of patients with confirmed liver cirrhosis and in approximately 25% of patients with congestive heart failure, frequently before either diagnosis had been formally established. Your nail bed was already reflecting the compromised internal circulation before the echocardiogram or the liver biopsy confirmed what was happening. The fifth sign is yellow nail syndrome, and I want to be precise here because this is not staining from nail polish or turmeric. In yellow nail syndrome, the nails grow at a severely reduced rate, sometimes less than 0.5 millimeter per month, which is less than 1/3 of normal. They become thickened and overcurved. They develop a true yellow to yellow-green discoloration across the entire plate. The cuticle disappears. The nail may begin to separate from the bed. This entire constellation of changes is caused by compromised lymphatic drainage to the nail bed. The lymphatic system is the network of vessels that removes metabolic waste from tissues and returns protein-rich fluid back into circulation. When that drainage fails, metabolic byproducts accumulate in the nail matrix. The matrix slows its production and loses its structural organization, and the result is a thickened, yellowed, slow-growing nail. Yellow nail syndrome is associated with lymphedema, which is pathological fluid accumulation in the tissues, and with pleural effusion, which is fluid accumulating in the space around the lungs. In adults over 60, true yellow nail syndrome should prompt immediate investigation for undetected pleural or lymphatic disease. The fluid is usually already present in significant volume by the time the nails have visibly changed. The sixth sign is half-and-half nails, which clinicians also call Lindsay's nails. If the color check showed you a nail that is white in the half closest to your hand and reddish-brown in the half closest to your fingertip, with a sharp, distinct line between them, I need you to pay particular attention right now. This pattern is highly specific for chronic kidney disease, and it forms through two simultaneous kidney-related failures happening within the same nail. The reddish-brown distal band forms because of elevated beta-melanocyte-stimulating hormone accumulating in the blood. When the kidneys are not clearing this hormone efficiently, it stimulates excess melanin deposition in the distal nail bed, producing that brownish color. At the same time, the proximal whiteness reflects anemia of chronic kidney disease, a specific anemia driven by insufficient erythropoietin production. Erythropoietin is the hormone the kidney produces to signal the bone marrow to make red blood cells. When the kidneys are failing, erythropoietin production falls. Fewer red blood cells means the proximal nail bed loses its pink color. One nail is showing you two separate organ failures simultaneously. A study published in the Journal of the American Academy of Dermatology found Lindsay's nails present in approximately 40% of patients with confirmed end-stage renal disease requiring dialysis. 40%. Many of them had no other visible external findings. Their kidneys were failing, and only their nails were speaking. The seventh sign is the splinter hemorrhage. Shine your light under your nail plate and look lengthwise in the direction the nail grows. Do you see any thin, dark red or brown lines, like a tiny splinter of dark material trapped under the nail? Splinter hemorrhages are small ruptures within the capillaries of the nail bed, caused by blood clots or embolic fragments lodging in those tiny vessels. A single splinter hemorrhage on a dominant hand fingernail after physical work or minor trauma is meaningless. But multiple splinter hemorrhages across several nails, particularly on toenails, or appearing without any history of trauma, are a different clinical picture entirely. That pattern is a classical external sign of infective endocarditis, which is a bacterial infection of the inner lining of the heart chambers and valves. In endocarditis, fragments of infected material break away from diseased valve tissue, travel through the bloodstream as septic emboli, and lodge in the capillaries of the nail bed, producing that distinctive pattern of dark lengthwise streaks. This is why experienced cardiologists examine the nails during a cardiac workup. It is not habit, it is diagnostic reasoning built over decades. Multiple atraumatic splinter hemorrhages should prompt cardiac evaluation, not a manicure. And right then, the picture clicked into place for me with one of my patients, and I want you to hear her story. I want to tell you about one of my patients. I will call her Mirella. 63 years old, retired school administrator, originally from Croatia, living in the American Midwest. Not someone who complains easily. She had not seen a doctor in 4 years when her daughter finally persuaded her to come in. Mirella sat across from me and told me she was tired, that her ankles had been swollen off and on for months, that she thought it was the humidity or stress, or the fact that she had been on her feet more than usual. She had attributed all of it to getting older. She was not alarmed. She was resigned. I looked at her hands before I asked another question. Her nails were telling me something her history had not yet reached. The proximal halves of all 10 nails, both hands, were white. The distal thirds were a dull pinkish brown. The line of demarcation between the two zones was sharp and distinct. Half and half nails, bilateral, complete. I asked her one question. I said, "Have you noticed anything unusual when you use the toilet? Any foaminess in the water when you go?" She paused for a long moment. Then she said quietly, almost embarrassed, "I thought that was just soap." I told her it was not soap. We ran a comprehensive metabolic panel and a urinalysis that same afternoon. Her creatinine level, which is the waste compound that measures how well the kidneys are filtering the blood, was 3.1 milligrams per deciliter, more than twice the upper limit of normal. Her glomerular filtration rate was 19. She was at stage 4 chronic kidney disease, one stage above requiring dialysis. She had no pain, no dramatic symptoms, no moment that had made her think something is seriously wrong. Her kidneys had been deteriorating progressively for what the nephrologist later estimated was 3 to 4 years. Her nails had been recording the entire process. We had simply never looked. Mirella is now under nephrology management, and her kidney function has stabilized. But the window to intervene earlier, when more functional kidney tissue could have been preserved, had already narrowed considerably. Her case is not rare. I have seen this pattern dozens of times across over 2 decades in practice. The nails told the truth long before anything else did. Now let me tell you about several habits that silently accelerate every one of the conditions these nail signs reveal. Because there are things a majority of adults over 55 are doing every single day that are quietly making all of this more likely. The first is long-term proton pump inhibitor use. Medications like omeprazole and pantoprazole, acid blockers taken by tens of millions of adults for heartburn and reflux, significantly impair the intestinal absorption of magnesium, zinc, and vitamin B12 when used for extended periods. These 3 micronutrients are essential for normal nail matrix function, red blood cell production, and peripheral nerve health. Research from Stanford University's Division of Gastroenterology documented measurable reductions in serum magnesium in patients on long-term proton pump inhibitor therapy, reductions that developed silently over months to years without producing obvious symptoms. The first place that silent deficiency often appears physically is the nails. If you have been on an acid blocker for more than 6 months, your micronutrient status needs to be formally checked. The second habit is dietary sodium above 2,300 milligrams per day. Chronic high sodium intake sustains a state of mild fluid retention that impairs peripheral circulation over years. The circulation to your hands and feet is the first to suffer when the heart is working harder than it should against excess fluid volume. Over time, that chronically impaired peripheral circulation contributes to exactly the kind of nail bed vascular changes that manifest as Terry's nails and Lindsay's nails in people with underlying organ vulnerability. The hidden sodium in commercial soups, deli meats, canned vegetables, and packaged sauces is the source most adults never calculate. Most people over 55 are consuming significantly more sodium than they estimate. Write this down somewhere you will see it. The third habit is attributing progressive fatigue to aging and leaving it uninvestigated. Fatigue is the common final pathway of anemia, kidney disease, congestive heart failure, and thyroid dysfunction. Every single one of those conditions produces nail changes before it produces dramatic symptoms. Most adults attribute worsening tiredness to getting older, to poor sleep, to stress. And so the nail changes accumulate quietly, the fatigue deepens slowly, and the underlying condition continues to progress without treatment. Fatigue that has been worsening gradually over months is not aging. It is physiology sending a signal. It deserves a blood panel, not an early bedtime. Here is the protocol I want you to follow. I call it the nail health audit. It costs nothing beyond the attention you give it once a month. Part 1 is the baseline photograph. Today, in good natural light or under a bright lamp, photograph all 10 fingernails and all 10 toenails at close range. Label the photo with today's date and save it somewhere you can find it. Do this every 30 days on the same day of the month. The nail matrix records approximately 3 months of your systemic health on the visible nail plate at any given time. Changes that happen gradually are invisible to daily observation, but unmistakable when you compare photographs taken a month apart. This is the same principle dermatology uses for mole surveillance. You are creating a medical timeline on the phone already in your pocket. Part 2 is the capillary refill check. Each morning, press firmly on the nail of your index finger for 5 full seconds, and then release. Count how long it takes for the pink color to return. Under 2 seconds is normal. 3 seconds or longer, consistently across multiple fingers, is prolonged capillary refill time. It is a marker of reduced cardiac output or peripheral vascular insufficiency. Track this number. Do it at room temperature, not after cold exposure or exercise. Part 3 is the monthly Schamroth test. Each time you take your monthly photographs, press your index fingernails base to base and check for the diamond gap. If the gap is present, note it and move on. If the gap is absent, document it and mention it specifically at your next medical appointment. Do not self-diagnose. Document and report. Part 4 is the vertical streak log. In your monthly photograph review, look specifically for any new dark streaks running lengthwise that were not present in last month's photograph. If a new one appears, particularly on a single nail and widening at one end, schedule a dermatology appointment within 2 weeks. Do not wait for an annual physical. Part 5 is the context review. When you identify any change, bring 4 answers to your appointment. Are the changes appearing on all fingers or only some? Have I been ill or under significant physiological stress in the past 3 months? Have I started any new medications? Do I have a family history of kidney disease, cardiac disease, liver disease, or autoimmune conditions? Bring those answers and your photograph series. Tell your doctor you want your nails formally assessed as part of your workup. Hand them the photographs. Morella did only that. She began photographing her nails monthly after her nephrology referral. At the 1-month mark, the reddish-brown distal band had begun to soften slightly as treatment took effect. At 3 months, her nephrologist was using the photograph series as part of her formal monitoring protocol. At her last visit, she told me that she finally felt like she understood what her own body had been trying to say for years. She said, "I just did not know the language." Now she does, and now you do too. How old are you? Write your age in the comments right now. I want to see which age group makes up the majority of our viewers, because it will directly shape what I cover in future videos. If you are over 60, I have content coming that is built specifically for where your physiology is right now. Write it in the comments. Here is exactly what to do after watching this. Step 1. Photograph all 20 males today in good natural light and save the image with today's date. Step 2. Perform the capillary refill test on both index fingers tomorrow morning at room temperature and note how many seconds it takes. Step 3. Perform the Schamroth window test and note whether the diamond gap is present or absent. Step 4. Go back through the 7 signs covered in this video and write down any that match what you observed in your nails today. Step 5. If you identified 2 or more findings, schedule a comprehensive metabolic panel, including kidney function, liver enzymes, and a complete blood count with your physician within the next 30 days, and bring your photographs with you to that appointment. Your doctor is not going to walk you through this at your next appointment. There is no revenue in it. There is no time on a 12-minute office visit to explain bilateral Mees limes, or to walk through why an absent Schamroth window in a 62-year-old without a respiratory diagnosis warrants imaging, or to teach you how to read a nail matrix timeline that has been printing for months. There is no financial incentive to keep you out of the waiting room. That is the reality of the system you are navigating, and I am not going to pretend otherwise. I am Dr. Candace Miller, and I have spent over 20 years watching what happens when people dismiss the signals their bodies have been sending them for months, sometimes for years. In almost every case, the damage was preventable. The tragedy is never that the body stopped warning them. The tragedy is that nobody ever taught them to listen. The protocol I just described requires no prescription, no procedure, and no money beyond the phone already in your hand. It requires only the understanding of how your body actually works and the discipline to use that understanding once a month. Subscribe to Dr. Candace, hit the like button, and help us reach 500,000 subscribers. Every person who subscribes makes it more likely that the next person who needs this information finds it before it is too late. This video is for educational purposes only and does not constitute medical advice. Always consult a qualified healthcare provider before making changes to your health routine.